Instrument-assisted soft tissue mobilization. Gua Sha, Graston, SASTM, IASTM. What do you do? Whatever. Okay. Do you have the Graston tools? Okay. No, it's a similar process. Urson's a great guy. Urson Regiolosi. He developed the Edge. He has a couple different soft tissue tools. He has a cupping set now. Um, so that it's a similar class, but everyone's a little bit different in their design. Graston says they were the first. They've actually reduced the price recently, but I think it's still like $2,200 for the set of tools. And you can't buy the tools unless you've gone through at least one training, which is $500. SASTM, which stands for Sound-Assisted Soft Tissue Mobilization, they're about $2,000 for a set of tools. IASTM's like the Freemasons of the soft tissue world. You can't find out anything about them on their website. You have to go to one of their courses. I'm told that the tools are about $1,900, but the guy that was talking to me about them has disappeared. I can't find him now. So, the IASTM. The big difference is what it's made out of. Graston's stainless steel. SASTM's a ceramic tool. IASTM's a plastic polymer, correct? Okay. None of those are the original techniques, though. The original technique is a Chinese medicine technique called Gua Sha. It's about 3,000 years old. Stands for Gua, meaning to scrape, which isn't really a true indication because it's not as painful as scraping sounds like it's going to be. And Sha refers to a reddening of the tissue that occurs. The tools are anything with a flat edge. One of my undergraduate professors was certified in Graston, and he had the tools. He is also a sales rep for SASTM, but he taught us using the handle of reflex hammers because we had plenty of those to go around. Depending on what part of Asia you're in, it's called different things. In South Korea, it's called coining because everyone has these large metal coins for currency, so that's what they use. They're a lot bigger on self-care techniques over there than we are. This is taught in like elementary school so that people can treat themselves. In Laos and Thailand, the coastal countries where they eat a lot of fish stews, fish stocks, it's called spooning because everyone has these ceramic soup spoons that they use. Be careful with your terminology with patients. It's always fun having a patient go home telling their spouse that they'd been spooning with me that day. So you might not want to call it that. Treatment. The patient tells you when to stop treatment. You'll rub until the skin discolors. Once it stops discoloring or deepening, you don't treat anymore because it's not going to be of any benefit. Typically, treatment times 1 to 2 minutes, again, per area that you're treating. The patient will tell you when to treat again because you won't treat again while there's still petechiae discoloration there, and we'll talk more about that as we go along. You want to put them in a neutral position, and it's kind of like the same thing with the myofascial techniques. You can do different grades with this, although it's not specifically broken down into grades. I tend to start people in the no tension and work them into a lengthened position. It just makes it more comfortable for them as you're working along. In traditional Chinese medicine, again, a lot of times this is taught to just lay people. So there's two techniques. There's a scanning technique, which is a long, slow stroke over the area. You're trying to identify areas of adhesion. You'll either feel the adhesions with the tool or they'll start discoloring. And oftentimes it's both. And then you switch over to the treatment method, which is short, fast technique over the areas of adhesion. We as highly trained clinicians should be able to go more directly to the treatment portion and be fairly accurate with where we're treating. You want to use some type of lotion to help protect the skin. It does not matter what type of lotion you use. Having said that, it matters what type of lotion you use if you're going to be doing taping afterwards. Most commercial lotions are just too oily to try to tape over. So Rock Tape does make a lotion called Rock Sauce. It's kind of like Biofreeze, except it gets hot or warmer instead of cold, and it tapes pretty easily. You can tape pretty easily over that. Honestly, I've used that in the past, but for the most part, what I use clinically is ultrasound gel. I already have it there. It's not something else I have to worry about ordering. It doesn't have a smell to it. It doesn't stain anything, and it cleans up pretty easily since it's just water. You can tape over it as well. So petechiae, it's the skin discoloration. In Eastern medicine, it's referred to as Shaw, talking about blood stagnation, but more in Western medicine, it's talking more with fascial adhesions. It's not bruising. It may look like bruising, but it doesn't work quite the same way bruising does. Araya Nielsen did her PhD on the effects of gua sha, and they used micro something imaging to image the capillary beds. With bruising, you get destruction of the capillary beds, and they bleed out, and that's why there's a discoloration. With gua sha, they image the capillary beds before and after. The capillary beds are left in place. It's just that the way the tools were designed, it pushes the fluid out. The petechiae can be diagnostic. If there's just a pink discoloration, that's not a fascial adhesion. That's just increasing blood flow to the area, and that's not an indicator of abnormal tissue. When we start getting into shades of red, light red can be minor adhesions or subacute. Darker red can be moderate adhesions and late stage subacute, early stage chronic. Purple discoloration is severe adhesions in the area, and is indicating of a chronic, very chronic condition. With multiple treatments, there's less discoloration. It's not as uncomfortable, and the discoloration does clear up quicker. I'm very clear with my patients beforehand. I'll show them pictures of what it's going to look like, and if you can get them to agree to the treatment once, they'll want you to do it every time because of how quickly and efficiently it will decrease pain while increasing range of motion. Having said that, I also very aware of what's going on with their personal lives. If they have any major events, I was working in a clinic, and it made it even more fun since it was my boss's daughter at the time. But she had been in a car accident, and I treated her upper back several times, so she knew what it was going to look like. This was an appointment on a Thursday, and after the treatment for that day, and she's all discolored, she's like, "Oh, I forgot. I'm in a wedding this weekend, and it's an open back dress." So we did a lot of lymphatic drainage taping techniques and things like that, and she was color free for the pictures then, fortunately. But this is a case study that I did. She was in a car accident. She hit a deer with her car. And so the first treatment up here was a week after the accident. And you see major amounts of discoloration. I saw her another time that week, didn't treat. A week later, she followed up. You can see there's discoloration, but there's significantly less, indicating that the fascial adhesions are improving. Down here, there's very, very minimal. A little here where the seatbelt was contacting her shoulder still, but other than that, the cervical spine had cleared up. Now, the really interesting thing with her, and there's no way I could have planned this, but on the fourth and final visit, she has more petechiae in her neck. She had been on a transatlantic flight and fallen asleep for 5 or 6 hours in this position. So she'd re-damaged that tissue, and she had the fascial response indicating that had happened as well. So with this, I get asked a lot, what areas do you treat? Yes, I'll treat anything. I've treated facial TMJ issues with the technique, headaches with treating the cranial fascia, and forehead, feet, you name it, I'll treat it. So I've taken some pictures over the years. The top left one is just general thoracic pain. And that's typically, if you search for gua sha, that's the typical picture that you'll see because that's what they do most in Chinese medicine. It's all posterior treatments. This is an interesting one. It's kind of hard to make out from the picture sometimes. That's her gluteus maximus. She was diabetic, and the injection site, that's what she would use. So she had areas of scar tissue. So unlike with the other pictures where the entire muscle's a red line, if you look closely at that, it's just little red dots. And the little red dots are the injection sites and the scarring that she'd caused of the fascia by inserting the needle and taking it out. SCM scalenes for torticollis. And again, it doesn't have to follow the line of the muscle. Going back to our phone from earlier, that's not a muscle line. That's just a straight-on fascial adhesion. A massage therapy student who had to drop out of the course before coming to our clinic because of thoracic outlet on the right side, so that's what pec minor, pec major look like. But the most interesting one I saved for last is the top center one. Which side of his back did I treat? Who says right side? Everybody says right side. I treated both sides. He came in with a right lateral flexion that day. So all the tissue on the right side was contracted. So that's what responded. You treat the normal tissue on the left side, it doesn't respond. So you get immediate feedback whether or not your working diagnosis is correct, because if it's the dysfunctional tissue, it's going to change color. I've used lots of different tools over the years, and I now work with a French company called Gervais. I'm in the South, or Louisiana, so I thought I'd put a French accent on it. How about Gerber? Everyone's more familiar with Gerber. It's a stainless steel spoon. It's stainless steel like the Graston tools, so it's more comfortable for the patient. It holds up much better to cleaning with disinfectants than a lot of the other tools. But it's also thin where I can feel the areas of adhesion with it. And patients like it, and it's like $5 for a 4-pack. So I can travel pretty easily with that too. So who was someone that had tight gastrocs on the hip hinge? Is that coming back to anybody? I'm going to come back to you. I'm looking for something specific. Nope, okay. Well, you can go ahead and come up then. I'll get into why I was trying not to pick you. I was hoping to see skin discoloration. With darker complexion, it's kind of hard to see. You may get a little bit of purpling, so what you end up going based on more is the feel of the soft tissue, going through those adhesions again. So let's go ahead and go face down, feet off this way, please. And if everybody wants to come up for me. Thanks to the Holiday Inn for providing lotion today, because I can't carry a 6-ounce bottle of lotion on the plane, but these I can carry on. Also, just another TSA warning. Does anyone know what this is? Mobilization wedge. That looks like C4 on a TSA screening. So I've been pulled in a couple times for that. Not yet. I'm waiting for that to happen. One of these times I'm going to put a TINS unit in too with it, just so there's wires going to it. So let's see, which one's worse? This side's worse. So she's in about 10 to 15 degrees of plantar flexion. When I come in and I try to tension her more, I still can't get her to neutral. Oh, she started creeping. Now she's to neutral, but I can't take her farther. So a little bit of lotion. And I'm going to put her in the position the movement does. With the gastroc, I will actually do a little bit of scanning. Very rarely, she actually does. Most of the time, it's not going to be in the muscle. It's going to be down at the muscle-tendon junction. Also, I always wanted to show the patient how much pressure I'm using. So that's as much pressure as I'm using. It's very, very light again, about as much pressure as you'd use combing your hair. But it's going to feel quite a bit different down here where she has the adhesions. And you can feel all those bumps. So this is where I start my patient education about the fascia and the saran wrap. So as I'm working, I'm just going to start tensioning that tissue a little bit more, working her into that range of motion. And I tend to work both ways. It's just a more efficient treatment that way. But then when I start stretching her, I'll stretch her dysfunction specific. So I've not been timing. That's about 30 to 45 seconds worth of treatment. So now when I go in, first off, she's hanging in a more neutral position. And now when I go in and I move her, that's where she is. Does that feel like about the same amount of pressure as I was putting? So pretty quickly, you can change the tissue with this. Okay, very good.